Welcome to another 3-Minute Therapy podcast. I'm Dr. Michael Edelstein. I'm a clinical psychologist, do all my practice on Zoom, Skype, phone, and I'm joined here with my colleague, Kevin Benbow, and we're both REBT therapists. REBT is Rational Emotive Behavior Therapy, and everything we discuss is based on that. And Kevin, did you want to say something about yourself?
Yeah, I'm Kevin Benbow. I'm located in Yuma, Arizona. My practice is entirely virtual. I see people located in Arizona and New Mexico, and I take just about every insurance in my local area. Been in private practice now for about 13 years. Been practicing since about 2005, whatever that adds up to.
Yeah. And so Kevin is very practiced and experienced in rational emotive behavior therapy.
So, Michael, the question I get asked a lot is, what is 3-minute therapy? I get that question, especially as I refer people to your book.
Oh, yes. Thanks for asking, Kevin. And 3-Minute Therapy is the name of my book, 3-Minute Therapy, and it's entirely based on REBT, Rational Emotive Behavior Therapy. And we'll be discussing death and dying today from an REBT perspective. And REBT is a powerful form of psychotherapy, brief psychotherapy, that teaches you how you can be your own therapist. So there are a few tools, principles, techniques you can use to address almost all emotional and behavioral problems. So today we're going to be discussing death and dying. And it seems to me, Kevin, that the main problem with dealing with death and dying is more the living, who are living with people who are dying, who are living with people who have died. They are often not prepared. The people who have died are out of their pain, but the people who are still living with it, living with loved ones or relatives who have died or suffering with it, those people are often have a lot of difficulty dealing with that because of their fears and anxieties and ignorances about death and dying.
You know, I've also made that observation. I've worked with quite a few people who are terminally ill, and I've noticed that quite often the people, the family members in their lives, are more shaken up about the impending death than the person who is dying themselves. That said, I've spoken with some hospice workers that would probably beg to differ with me on that, because they've also observed some people don't go gently into the night. They go with a great deal of fear, some of them. But quite often, at least in my experience, I've noticed the most anxious people are those who are around the person who's dying. They don't want to lose their loved one. And so they have this inflexible belief that they must not lose them.
Right. And you put your finger on it, Kevin, that the main emotional problem with dealing with death and dying is has the same cause as the emotional problem people have with anything, and that is, as you highlighted there, Kevin, creating your preferences into demands: must, should, supposed to's, have to's, world-ending scenarios. It's the end of the world. It's terrible, horrible, and awful, and I can't stand dealing with this. So in addressing death and dying, you start with a preference. I prefer not to die or at an early age. I prefer not to have pain in the process. And then you escalate that into a demand. Therefore, I must not die. I must not have pain. I have to avoid this. And the bad news, folks, is, as Kevin said, we're all going to die one day. So it would be useful now, if you have these fears, to start working on questioning, challenging, and contradicting those musts. I must not die. I must live a long, healthy life. And that's certainly not going to help you live longer. And it's certainly not going to help you live more healthily. That is, from the emotional point of view, because you'll be disturbing yourself.
If a person spends their entire life just terrified of death, and don't get me wrong, I think most of us have had these fears at one time or another. If we spend our entire life fearing death, we're not going to have very good quality of life in the present. This goes for all irrational fears. There's nothing we can do to prevent ourselves from dying, and there's nothing we can do to prevent other people from dying. It's important. I like to tell people it's important to just make peace with the fact that these things will happen. For the dying, or those who are afraid of dying themselves, I like to quote Fritz Perls. He would find out a person's birth year. For example, mine is 1967. And then he would ask, well, what do you remember from 1966? And of course, my answer would be, not a damn thing. I don't remember anything from 1966. And his contention was, that's what it's going to be like to be dead. Process of dying is another matter altogether. Who wants to go through a bunch of pain? But we might not be able to avoid it. I hope to
Yes,
die with a lot of morphine in my IV.
yes, yes. Or in your sleep.
Yes, that would be preferable, but I can't guarantee that'll happen.
Right, right.
Mhm.
And in terms of preventing ourselves from death and dying, I agree we can prevent ourselves, but certainly we could do things to make our lives more healthful while we're alive, and maybe live a little longer if that's one of our goals. And so the main ways to live a little longer is through a healthy diet. And unfortunately, different people have different ideas about what a healthy diet is. So I suggest you do research, look at the original studies on different diets to come up with your conclusion. And that could help you live a little longer, and certainly with a lot less illness, hospital stays, and pain.
Interestingly, I've been lately. I've been doing research into what are called the common factors of psychotherapy, and I found out that 50% of all people who visit doctors don't take their medications as prescribed. I think a little bit of medication adherence would probably also prolong the lives of people, especially those who taking high blood pressure medications, that sort of thing.
Actually, it depends. I think that's good advice in many cases, but it also depends on the medication. Simply because a doctor prescribes some medication, that doesn't mean it's a good idea or best for you. So again, I recommend being an informed consumer. Look up the medications, look up the side effects, look up other ways to be healthy. Often there are more natural ways to be healthy. As I mentioned, diet, good diet, exercise, sleep, those kinds of things, and maybe even using REBT to minimize the stress you cause in your life. Remember, it's never the situation that causes your stress, but rather it's your thinking about it. And it's never death or dying that causes your worry about it, but it's your thinking about it, your musts and shoulds about it. I must not die. I must not be in pain. Or if you are in pain, I must not have this pain. Because if you are in pain and you're telling yourself, I shouldn't have this pain, I shouldn't have this pain, I should be out of my pain, that tends to lead you to dwell more on the pain, magnify it, and make it seem worse.
And I think I've mentioned before, I experienced that with the pain that I have from my MS. if nothing I take for my MS relieves pain, basically. And I find that if I spend more time concentrating on what I'm feeling, well, then I'm going to feel more pain. One thing, going back to medication, one thing I found important as a person that takes an awful lot of medication is to have a good line of communication with the prescriber. If you're having unbearable side effects, not that, well, some side effects we can wonder, are they truly unbearable or not? If you're having side effects that are difficult to manage, it's important to tell the prescriber that rather than just unilaterally discontinue a medication. There are quite a few people who have discontinued antidepressants, for example, to their detriment. Having a rebound effect is possible. So there are a lot of things there. But we're all going to die. My dad is fond of reminding me that nobody gets out of this place alive, and it'll happen to all of us at some point.
Yes, and to highlight what you said before, the state of being dead is the same state you were in before you were born, which is there was no you.
Mm-hmm.
So that's something that's important to consider. Okay, that's my final word. Did you have anything else you wanted to mention, Kevin?
I really don't think so. I think that's basically it. The idea that I must not die is about as irrational as it gets. Uh, Perhaps someone who's in a gunfight might say I must not die right now, and really I don't want to die right now.
Yeah.
Fear of death may cause people to make irrational treatment decisions. One particular person I have in mind went down to Mexico and spent a bunch of money on some bogus treatments that were offered down there. If you're going to die, I think it's best just to accept it and get on with it.
Yes, yes. Actually, some people have been known to celebrate their dying and have friends around them and things like that. I think that's more of an Irish a tradition. But and you said one of the most irrational ideas you can have is I must not die. That's pretty irrational. But Albert Ellis has come up with a more irrational idea, and that is I must not act irrationally or think irrationally. That's even worse because that goes on for your entire life. Okay, thank you very much, Kevin, for being my partner in these podcasts. We generally have one every single week, so keep an eye on 3-Minute Therapy Podcast on our YouTube channel and Podbean channel. And if you liked what we said or found any of it useful, give us a thumbs up, please, and contribute to Patreon to help support us. I'd also like to thank Chris Rossini in the background, who's our technical person and keeps us going on YouTube and Podbean. And don't forget to work on your musts and shoulds, eliminate your demands to stay on the rational side of life.